Jewish Home Lifecare has been an organization serving the frail elders of New York City for 165 years. Today, we serve 10,000 elders a year in a continuum of care that includes skilled nursing care, post-acute care, home care, telehealth, housing, medical model and social model daycare, and care management. Today in the United States, 10,000 baby boomers become 65 every day. As a country, America is terribly unprepared to meet the health and social service needs of this population. At Jewish Home Lifecare, we have come to learn that people want to remain in the place they call home. Now that might be an apartment they've moved to for seniors housing. It might be the home that they raise their children. It might be assisted living. But like all of us, seniors want control, and they want to be able to live their lives on their own terms. Telehealth helps them to do that.
We started using telehealth at Jewish Home Lifecare in 2002, and we started in our home care programs first. We had patients that we were providing home care services for that were going back to the hospital, and we wanted to see if we could use technology to have an impact on that. So we spent a lot of time picking a telehealth device, and we decided on a non-video telehealth unit. It's very simple to use. It doesn't intimidate the clients that we service. The device has attachments to it so it can take vital signs, but it also has dialogues that Jewish Home Lifecare has developed that ask questions about their overall state. And it will automatically alert us if any of the clients that we service might have signs of early decompensation. And that allows us to get assistance to them before they decompensate to the point where they have to go to the hospital.
One of the principles of providing care for the elderly is that symptoms of serious illnesses can be masked and can be very subtle and nonspecific. And so the ability to detect changes in condition early in the course is absolutely essential to keeping people out of trouble. Someone who has congestive heart failure may start gaining weight and having difficulty. Without telemonitoring, it may be 2 or 3 weeks of worsening problems before they come to healthcare attention. With telemonitoring, we're able to combine biometric data of blood oxygenation and weights to really give us an early warning sign of impending problems.
The other big benefit is it allows our patients that are in their home to constantly feel connected to us. And we've also learned that they will tell things to the telehealth unit that they won't necessarily tell the home care team or their family or the community doctor. So sometimes they'll tell the telehealth unit that they had a fall because they know the telehealth unit is not going to chastise them or to yell at them. But that allows us to put home modifications in place to prevent the next fall. So it definitely allows our clients to age in place safely. We started with individual units, and then we realized the benefit of the technology, and we started looking at models where we could use it in congregate settings. So now we use a telehealth kiosk. It works very much like an ATM machine does. The patient can go up to the kiosk and they have a swipe card, or they can put in a 4-digit code, and then it greets that person individually and will pull up questions specific to that person. So we've used the telehealth kiosk in our day center programs. We've used it in our housing and with our natural or current retirement communities, and we have actually been able to demonstrate that there's an increase in health literacy with the clients that use that kiosk. So it's not only the clinical outcomes, but it's empowering the clients that we service to really start owning, here are the things I can do to make a difference to my disease process.
The kiosk machine is a computerized machine which keeps the clients informed of their health, also along with their stay in the rehab, and it gives them an idea how to go about adjusting to the lifestyle of the life care. I like being there and showing them how to cope with their illness, and as you say, how to get back their independence.
We want to be able to stay connected to people after they leave here and help them connect with their community physicians. And so by combining the telemonitoring equipment with some of our professional nursing services, we're able to be the eyes and ears for the community physician, often before that patient sees the community physician after discharge. And that's changing people's lives in that they're continuing to get information about their healthcare needs. Their education about healthcare is continuing before they even see their physician in the community.
Our mission is to promote quality aging with a focus on independence, support, and dignity. And all of the programs that we provide always use that as their main center focus.
At Jewish Home Lifecare, we know that going forward, a greater and greater percentage of our clients are going to be served in the community because they want to, because they have the right to, and because we want to support them doing that. So part of what we want to do is have greater numbers and diversity of applications so that we can meet as many needs as possible for elders residing in the community.
The more we bring technology into empowering the clients that we service, the more of a difference it's going to make with how healthcare reform is going to happen moving forward in a positive way so that older people can actually stay at home with real quality in their lives, supported in a cost-effective manner.